Y'all want to hear something wild? I just tried to renew my healthcare and dental coverage and called my current insurance company. They had a little thing on their website that was like, if you don't renew through Marketplace, your plan will automatically renew. But if you'd like to make changes, you can go through Marketplace. And I went to the Marketplace, did my application. My monthly premium, like the cost per month that I was going to pay, went up $500, and my deductible went up $5,800. And I was like, no. So I call my insurance company and I'm like, hey, I saw that if I don't renew through Marketplace, my coverage will stay the same. Everything stays the same and it'll just automatically renew. Is that correct? And she's like, yes, that's correct. You don't have to do anything. And I was like, okay, what about dental? I currently have them like together through Marketplace from last year. She was like, no, your dental is going to expire, so you need to renew. So I go back on healthcare.gov, go to try to renew my dental. It won't let me unless I accept the updated, outrageously, obscenely more expensive healthcare plan for the exact same plan that I'm about to get at the same price, just for auto renewing it through my insurance company. So then I call healthcare.gov and I'm like, hey, I'm just trying to renew my dental insurance. And they're like, you can't do that. And I was like, but I'm enrolled in insurance, in health insurance. I just need the dental. And he's like, that's not possible. So I'm about to have no dental insurance because they won't let me, because I refuse to pay $500 extra a month and $5,800 extra in my deductible for next year. I guess my teeth are just gonna have to wing it. This is insane.
That's so crazy. I'm like really irritated about what I just read. So let's go ahead and go through some more videos and then I'll come back with what I gotta say.
Watch this if you have health insurance in America. Hey, does my health insurance cover this doctor visit? It looks like you haven't reached your deductible yet, so you're gonna have to pay out of pocket $500. What? That's insane, but I pay like $250 a month for my health insurance. Your monthly payment is your premium. That's just what you pay to have health insurance. And your deductible is how much you're gonna have to pay out of pocket before your health insurance kicks in and covers the rest. So you're telling me that I have to keep paying out of pocket until I reach my deductible, and then that's when the health insurance company will help me pay? Exactly. Wait. What's my deductible at? You have a $8,000 deductible. But let's just say you had a $10,000 bill. In that case, you would have to pay $8,000 and your health insurance company would pay the remaining $2,000. Many people are not educated enough to choose the right health insurance plan for them. In many cases, they just choose the cheapest plan. That could come out to being the most expensive plan. Because for example, in your case, you could have just paid maybe an extra $50, $100 more a month, and you could have had a way different plan that had a deductible that was way lower. We're talking $100 deductible compared to your $8,000 deductible. Man, I didn't know any of this. How did you know? I learned all my money hacks from Josh. That's why I follow him. You should too.
The U.S. healthcare system has about a month before it breaks. ACA premiums are projected to jump up 26%, and people can't afford it. So when people can't afford insurance, they go without it. They split pills, they skip treatment, they don't go to the doctor until they're at death's door. And then they go to the emergency room, which is literally the most expensive type of care that's available. Hospitals still have to treat them, costs surge, bills pile up, and the system snaps. And there is absolutely no warning, no safety net, and no way around it.
How are we here in one of the world's richest, most profitable economy? How are we here to where health insurance is crippling the average person? It makes no sense to me. And once you hear this stat, when it comes to how much people are paying and premium, is diabolical. It doesn't make any type of sense. So I Googled real quick, health insurance premium stats. That's all I Googled. And this is what Google AI came up with. In 2025, an annual premium for employer-sponsored family health coverage reached $26,993, a 6% increase over 2024, with workers contributing an average of $6,850. Family premiums had doubled over the past 2 decades. Premiums are rising faster than inflation. And I wonder why. Driven by increased utilization of services, chronic disease care, and costly prescription drugs like GLP-1. So you guys are telling me y'all including people who are using GLP-1s onto average day Americans who have health insurance for things that does not have to do with cosmetic. Now, GLP-1s, I have to say, is not only cosmetic. Of course, those are for people with diabetics, with diabetes. Those are diabetics, people with diabetes. But I feel as though they're including those that are cosmetic, those who are doing it for weight loss into this to increase their premiums because ain't no way. GLP-1s have always been on the market, right? So the influx, I understand the popularity of GLP-1s that came to surface in the past 2 years. I understand the more usage of that. But you can't tell me all of a sudden, because so many people are using it for weight loss or so many people are using it in general, that means you guys have to increase the premiums. I don't know. But that's not really what's concerning me because I'm not a family. I'm just myself. So I'm trying to figure out per person. Before we go into the individual of how much is rising, let's go to the long-term trends from 1999 to 2024, right? Total premiums increased by 342%, while workers' earnings grew by only 119%, and inflation was 64%. So this is why they say it's outgrowing inflation because this is like 3x. Well, not even inflation. This is 3x the actual earnings for wages. This is 4x what inflation is. You understand? So health insurance in all is increasingly rising for absolutely no reason. So let's go for the singles. Wait, hold on. Hold on. How much? All right, so listen to this. For single coverage in 2024, premium rose to $8,951. So you're telling me that single coverage for your total premium is $8,000, almost $9,000. So if I want to go to the doctor, in order for the insurance company to give their share, their part, I'm gonna have to pay almost $9K in order for them to start pitching in on their part, even though I'm paying a monthly payment for my insurance. So long-term trend, over the last 23 years through 2023, premiums have risen significantly and family coverage doubled by nearly 24,000. And guess what? I'm pretty sure your salary has not doubled. An impact on assets, 1/3 of adults, 36%, reported skipping or delaying needed healthcare in the past 12 months due to cost. Yeah, obviously. So in that case, when they get to a certain age when it's really needed, they're gonna use it. A lot of people are thinking if they can just wait it out a little bit longer, come in and come out whenever they need, it's doable. But when it comes to other things like Wi-Fi and mortgage and rents, those things you cannot come in and out because if you don't pay, you don't have. You know, when it comes to healthcare, it's like you don't pay, you don't have, but at the same time, it's not necessarily for that month compared to rent where you have to have a place to stay. I just bring it to the groundwork of greed because companies are able to have money in order for them to supplement what they say they're going to supplement. But they always want more and they feel as though they can always get more. And that's a problem I have. When is more enough to where you're squeezing, you're squeezing, you're squeezing? If you are going to be able to ensure a certain amount of people comfortably, just keep it as that. You don't have to go for the world. You don't. But a lot of companies, they do try to go for the masses, try to go for the world in order to expand and do all of this. People are opting out. It's crazy. Now, I don't know with other countries. I don't know the Dubai healthcare system. I don't know UK, India. I don't know their healthcare system, but I'm seeing more as when it comes to insurance. And I just feel like at this point it's just a cash grab. This entire topic when it comes to health insurance really grinds my gears because you think the people that you are giving your money to has your best interest in mind, but they don't. Time and time again, it shows that they don't. And I used to work in the dental industry. I used to work in a private office and seeing how insurance companies try to dip on paying, it's crazy. It's just showing a lot of people's current sentiment, feelings about what's going on financially. Anyways, thank you guys so much for watching. If you guys haven't subscribed yet, trying to grow this commentary channel where we talk about real stuff that affects us financially. So go ahead and do so, and I will see you guys in the next video. Bye.